Okay, so we're going to move into what else can we treat besides lupus with the same tools. And you can also treat hemolytic anemia. So I mentioned this morning about how there are occasionally owners that will put you in a tight spot where they will want you to move heaven and earth, and they feel like you can even when you don't feel like you can. And so Lancelot was one of those cases where I got thrust into that place, and the owners were cool with it, but they were insistent. And so I went ahead and treated him. So he's a 6-year-old male-neutered Shih Tzu, and this is a dog that, once again, Karin and I shared. So always the most important cases, it seems that Karin's somehow treating them. I'm not trying to read too much into that, but alas, it's probably true that I steal all her stuff. Anyway, so history, initial onset November 2012, associated with dyspnea, lethargy, and inappetence of a few days duration, craving ice and snow rather than water. So I don't know if you can pick up on that in San Diego when it's 90 degrees outside, but if you're living anywhere where it snows and you have owners volunteer this information, that in the middle of the night they'll get up and they'll just go and lie in the snow as decrepit as they are, or they will just go out and they'll just start to eat mouthfuls of snow in the middle of the night, that should tell you you need a bupleurum formula. That is as close to a homeopathic keynote as you're ever going to get for Chinese herbal formula. Nobody really knows what caused his what brought all this on. As is often the case with hemolytic anemia, it's sort of an idiopathic scenario. In the past, he's had a buphthalmos, which is painless. And so, Karin was treating him before I was, and so because he was painless, we just left the eye in. It really didn't seem to be a problem with him. Laboratory evaluation, he had a hematocrit of 13% and also very low platelets. What few red blood cells were there, a lot of them were nucleated. He had spherocytes and red blood cell agglutination, which was clearly noted on a saline prep. So it was very easy to diagnose him with hemolytic anemia and Evans syndrome due to the low platelet count as well. So he was initially treated acutely in a referral hospital we have here in Edmonton. He had a blood transfusion, he had cyclosporin, immune modulating doses of prednisone, and then famotidine and Cerenia to kind of deal with any stomach issues from that assault. And his initial response was good. Hematocrit increased to 30% within just a few hours, but unfortunately declined fully again over the next 3 days, despite continued therapy. They gave him a second transfusion, and that did help a little bit, but then it dropped once more. And so they finally kicked him out of the hospital when he had a hematocrit of 21.5% and dropping, and said, sorry, we really can't help you much anymore. We're not in the habit of doing 3 transfusions. So the platelets were slightly below normal at this point. The dog is still vomiting in the early morning hours. It's still extremely thirsty. Now he's chilly, and he's got these runny yellow stools. Okay. So we gave him this formula called Chinging Tom because of its reputation for dealing with this inhibiting basically hemolytic processes. And there's the Da Huang inside there. We used the Con Essentials version because it was easy to give, so just 2 mils 4 times a day. Started to taper the prednisone because I wasn't particularly convinced it was helping. And we kept the famotidine and sulcrate in play just until the prednisone was off the table. Another thing that I like to use in these cases, whether you have the herbal extract or a homeopathic version, is China officinalis. Basically, for those of you, anybody homeopaths in the room? So Samuel Hahnemann was the German physician famous for starting a system of homeopathy, and he was experimenting with anti-malarials, basically the plant source of quinine, and he noticed when he took it in rather high doses that he got the same symptoms of malaria that the that the drug was supposed to treat. And out of this came his notion that maybe we take things that would ordinarily cause those problems in us, but somehow they cure them instead when we've already got those symptoms. There are a lot of other symptoms that are attributed to basically the cinnamon tree from which quinine is extracted. And they include a lot of the symptoms of hemolytic anemia. So I always use this plant in hemolytic anemia cases, and it fits just like the herbal formulas fit, and I use the two of them together. The plant extract, if you can get a hold of it, tastes god-awful. I don't know how Hahnemann did his experiment. It's one of the most bitter things you could possibly consume. But the homeopathics are quite palatable. So I was giving that dog 30 C strength 4 times a day, which might make homeopaths curl their toes, but that's just the way I roll. It seems like it helps. So what happened? Within hours of instituting our acupuncture treatment, our herbal treatment, the dog's appetite is kicking into gear. Within 2 days, he's got a hematocrit of 25.5%, so slightly better than what he walked in the door with. And more importantly, we've reversed the trend of slow decline. At 5 days, his hematocrit's now at the original post-transfusion level, so just above 30%. And within 14 days, his hematocrit's normal. 6 months later, he goes into another hemolytic crisis. Most dogs that suffer a hemolytic crisis, I think the stat is something like 80 to 90% of them are dead within a year of their hemolytic crisis because they keep happening. And Lancelot was proof of the concept. So 6 months later, hematocrit of 10% this time, even worse, platelets low, but not critically low. She'd already been using Qingyin Tong. The dog had started to kind of get vomiting, restless, lethargy. Karin saw him and said, let's just start the stuff you were using last time. But no one was particularly worried during that visit because the red blood cell count was high, not low. So here's a little practice tip. If you have your hemolytic anemia dogs and they come in because they're kind of ADR and you're worried about a relapse of the anemia and you see a high hematocrit, don't get cocky, because oftentimes that high hematocrit comes just before the plunge. From a Chinese point of view, what the formula treats is a desiccating heat in the blood supply. Well, not in the blood supply, in plasma. Qingyin Tong means clear plasma combination, or cool the blood or cool the plasma. Well, what do you think would happen if plasma was being desiccated? What would happen to the red blood cell count or the hematocrit if your plasma is in the process of being desiccated? You'd actually start to see hematocrit go up. From a biomedical perspective, the body might be sensing that there's a sequestration going on and ramping up bone marrow output to accommodate it. So whatever way you like to look at things, if you see hematocrits kind of uptick in some of these hemolytic animals that aren't, or animals that have had hemolysis in the past, they're not doing it right now, keep watching and maybe go ahead and institute your treatments if you haven't already. We did what worked last time, but this time it didn't seem to work because he went ahead and developed his hematocrit at 10% anyway. But I still think there was an advantage, and I'll come to it. So now he's pale. He's got a palpably enlarged spleen, or at least it feels that way. He's very tachypneic, even with slight exertion. And he's got this time, this is where the owners put me in an uncomfortable spot that takes me out from behind the boulder, but makes me feel oh so afraid and humble and exposed and worried and not cocky in the least. But that is the position in which medicine advances. It's not from a position of cockiness, it's from a position of abject humility. So they put me on a spot and they said, we're not, he's either gonna die or you're gonna save him. We're okay with either. Honestly, the eye is really freaking us out. So, because he had the enlarged eye, never mind.
Did you identify a trigger of that episode?
So Gene was saying, was there a trigger this time? And still, again, no trigger, as with previous episodes. It was suspected up here that maybe we were over-vaccinating, but that is so not true. Okay. So I put him on, we remember the lessons of Sophie, which is that it doesn't always work to just work at the blood vessel level. Like sometimes you need to work a little higher up in the chain. So you bring something bupluramy in and continue what otherwise made sense and see what happens. When I'm dealing with a critical situation like this, I will oftentimes give about 6 times the normal dose of herbs that I would use, and I will usually give them rectally because it's as close as I can get to giving something IV. I know it doesn't sound that close, but it is close. So I was giving about 1.5 grams of a granular extract about 4 times a day in a 22-pound dog or a 10-kilo dog. So you can't do this with the glycerin extracts. They will come right back out again. But with granular extracts, you can suspend them in a small amount of liquid, maybe 3 to 5 mils of just warm water. Give it a shake in a jam jar or something. Take the jam out first. Give it a good shake, and then draw it up into a syringe. Try and place it in the transverse colon. Like use a rubber French tube, cut the end off, thread it up there, and just deposit that 5 mils and just let it sit. And it'll move into the portal circulation and do its work. We got the China officinalis going again. I didn't bother with the pharmaceuticals because if they want to make an experiment, all right, we're making an experiment. Karen would always give steroids. She doesn't have the faith in Chinese medicine, and I do always, but I'm like, balls to the wall, let's go. So after 18 hours, the dog came in with a hematocrit of 10%. 18 hours later, the dog has a hematocrit of 29%. And the platelets were still low. By 7 days, everything is in a normal range. By 22 months, there hadn't been any recurrences. Now, since then, Lancelot's had 1 or 2 crises. Treat him the same way. Takes a day or 2. He's done. He's treated as an outpatient for his hemolytic anemia. And we don't touch him with immune regulating drugs. We basically just do this, and he goes home, and he gets better. In fact, now we've begun to anticipate that it's going to be spring and fall, March and November, that he's going to have his issues, and now we just go ahead and start him on these herbs prophylactically, move him through those spring months, and then get him off it. Gene said, what's the trigger? And I said there wasn't a trigger, meaning that there's no environmental trigger that I know of, but the trigger in Chinese medicine is the time of year. And I'm going to come back to that in just a few minutes here.
How many years is it?
I don't know. Now it's probably year 4, year 5 since this all started. And, of course, I'm probably going to get smote down now because of my cavalier attitude up here. Oftentimes I find that happens. I call it the lecture effect. At precisely the moment I'm talking about one of these patients, it drops dead in whatever city it's in. And so let's hope that Lance, actually, you know what? Karen says he's fine. She just saw him on Friday. But this is not a word of a lie in this. I was lecturing about Lancelot in Vancouver last spring, I think it was, to a group of Canadian vets. And my phone rang in the middle of the talk because I had forgot to turn it off like I just did for this talk. And it was the clinic calling about Lancelot because he's in a hemolytic crisis. And I looked, and Lancelot's slides are on the, it's like it's a lecture effect. They're trying to die because, we have to maintain our humility, otherwise you're stuck behind the boulder. Yes?
How many times did you do the rectal?
So the question was, how many times did we do the rectal? I would have them do it about 3 to 4 times a day. Once the dog is out of danger, which in this case only took about 24 hours, I switched to oral and give it a couple times a day. And then we slowly kind of maybe lower the doses to a normal dose, see him through the season, and then we take him off it. Now we just put him on normal doses, normal oral doses at the start of his season, take him off at the end, give him a few months off, put him on normal oral doses at the start of a season, take him off at the end. So you're wondering, well, what's the season and why does it work? And tell me more. Or maybe you're saying, please get me the hell out of here. Anyway, Qing Tong was a good idea. It did help because I think it primed the bone marrow. One of the reasons why the dog responded so rapidly is as soon as you can arrest that hemolytic crisis, there's all these bone marrow stimulants in Qing Tong, and it's just like whoosh. The bone marrow was already in full force, and as soon as you remove the as soon as you take away the removal of those red blood cells into the spleen, then you give this bone marrow a sudden chance to kind of catch up.
Question, it really will change from 19 or whatever it was to 29? Was that just the spleen?
So the question, I think so. The question was, how could you have gone from a hematocrit of 10 to a hematocrit of 29 without a transfusion in 18 hours? And I think it was splenic contraction. Because what did we say about bupleurum? It shrinks big spleens. So bupleurum-based formulas are just perfect for whether it's ITP or whether it's anything that you're worried that there's a sequestration process going on in the spleen. I mean, God help us, I haven't had to deal with an intravascular hemolysis case in a long time. So as long as it's extravascular hemolysis, this approach should work pretty well. Okay, so we had something acting high up in the chain, bupleurum. We had something acting low down at the vasculature. Between the two of them, there's this incredible synergy, and we end up with rapid, consistent responses. So you can totally use the two together as sort of a synergistic interaction. So what does this suggest then about what autoimmune disease is? Have I got totally? No, we're past the break. Okay. What does this suggest that autoimmune disease is from a Chinese medical perspective? Like, what exactly is going on? So we're kind of coming out the other way. With Trinket and Cushing's, we started with the Chinese medical diagnosis and worked our way. We closed the loop this way, trying to figure out where's the science that we're missing, why does this work? Now we've kind of started with the science, and we're working our way around the wall the other way. We're closing the loop this way to say, what does the efficacy of these formulas mean is going on from a Chinese medical perspective, meaning that you can then open up the doors to looking for other therapies. So that's what we're going to look at next, for those of you that are interested in that sort of thing. And if you're not, I'm still going into it, so I'm sorry. But I mentioned that the trigger for Lancelot is seasonal, and you'll find for a lot of your immune-mediated cases, they're going to show up in certain seasons. You're going to find a lot of immune disorders show up between July and November. And if it's not going to be then, it's going to be somewhere around March and April. Those are going to be your big months for immune-mediated disorders. And it's because of what's happening in Chinese medicine at that time. So the question was, does this jibe with the circadian rhythm? And this is where we kind of get this model. There's an ebb and flow to life over the course of a year and over the course of a day. The same transition happens. It happens on a microscopic level over the course of a day, and then there's this big giant surge that also happens over the course of the year. So your body is composed of yin and yang, and each of them kind of moves from the core of your body to the periphery and back. And the same with yang, from the core of your body to the periphery and back. Now, they don't go exactly at the same time. They're kind of like two kids holding hands, and they're just kind of like slightly spread apart. So they're supposed to be largely together, but nevertheless, they're slightly out of step with each other. So yin energy is actually what moves out first, which might be a little counterintuitive to you, but we get that from the circadian rhythm chart. Yang energy follows. So yin moves out in the early morning when your sprinklers are on and it's still dark and the grass is wet. That's when yin has moved out to the periphery. Tai yang coming sometime later, around about towards noon. So eventually yang energy gets out to the surface where yin is. They hang out together for a while. Then yin says, whew, it's getting hot. I think I'm going to go indoors for a while. And so yin energy starts to move inwards under the influence of this Shao yin layer here. And then yang energy starts to feel a little lonely. And they decide, okay, well, it's mom's calling me for dinner. I got to go in too. And so this Shao yang layer internalizes this yang. And the two wind up in the house together, and they kind of go to bed together and sleep. That's all they do. And then in the morning, yin energy gets up early, got to get out in the job, and yang sleeps in. But then it gets, that's just kind of how the whole thing sort of repeats. When things die, when animals die, it's usually a problem with this yang energy. Yang energy's got to get out of the house and onto the street. And this is a gate. And sometimes that gate is rusty, and it squeaks or it sticks. And it sticks in both directions. Sometimes yang energy has trouble hatching, as it were. And sometimes yang energy has trouble coming home. Anytime you take yang energy and you say, stay there, and yin energy moves away, the separation of yin and yang creates the risk of death, because it's the combination of yin and yang that's the alchemy of life that generates qi. Qi being, probably Ted Kapchuk had the best definition of qi that I've ever heard, which is just the ability for something to happen, life force. So if you separate yin and yang for an extended period of time, you have no qi. If you have no qi, you have no life force. You're dead. And especially if yang energy gets trapped on the outside of the body, I mean, yang wants to leave anyway. It's all hot and excited and agitated, and it's like a little kid. They won't come in for dinner unless mom calls them, right? They're out there, you know, the street lights are coming on, they're still playing street hockey because they're Canadian. And meanwhile, you know, and so there's this complete, utter separation. If yang is stuck outside, it might just stay out. You know, get kidnapped by a child molester, and then yang is gone, and, you know, you just have yin, and then there's nothing. Okay. Okay, maybe I should stop with the metaphors, right? Yeah. Okay. So when we block this yang layer, at times we trap yang energy on the outside, and at times we trap yang energy on the inside. We essentially shrink wrap the body. Yang moves blood before it. And so if you trap yang, you trap the blood supply. And so two different scenarios, two different problems. In the case of our systemic lupus erythematosus dog, in hindsight, we can see she was shrink wrapped. So we used Qingying Tong to kind of help increase the peripheral circulation. Worked for a while, then not. We needed something else. Whenever, I don't know if you're familiar with the concept of roots and branches. In Chinese medicine, there are root conditions and branches. When you look at a dog in your exam room, all you can see are the branches. The points, the pulse, the tongue, the symptoms that day, those are the branches. And you have to prune those branches and act on those branches, and your dog will get better. And it'll stop getting better. And you'll think, oh darn, and you'll start to self-flagellate like a good Catholic. But then you'll remember what Steve said, which is that sometimes things stop improving because you have exposed the root, and the root needs a different treatment. Sophie stopped responding because we had exposed her root. The root of her impaired peripheral circulation was the stuck gate. We gave her a formula to treat the stuck gate, minor bupleurum, and presto, it enabled the efficacy of the Qingying Tong, which we were simultaneously using. In the case of Lancelot, his second hemolytic crisis, his gate is stuck with yang on the outside. Remember, it was fall. Yang's supposed to be internalizing, it can't. Yin has already gone. We have a yin-yang separation. This is an animal that could die in the next day if we don't play our cards right. So in that case, we needed something that has a yang internalizing effect, which is this chai hu, blah, blah, blah stuff. And that's what we, sorry? At chai hu, et cetera. And when we teamed that up with Qingying Tong, then we got those dramatic responses. So autoimmune conditions, in most cases, are essentially a problem with that gate, either getting out or getting in. Okay, we can dig a little bit deeper, for those of you who are not bored to tears by now. Still thinking of the body as a sphere, which is not hard when you look at me. Essentially, the core of your body is relatively yin. I mean, yeah, yang does go inside at night, but still, it just sits and watches TV in its man cave. So that's a relatively yin activity compared to playing hockey out on the street with its friends. So this is a very yin kind of yang that's in there now, just watching the boob tube, you know, playing video games, eating chips on the couch. And yin energy, this is a very yin form of yin energy as well. This is mom and pa kettle watching TV at night. That's what's happening in here. And so this represents the innermost yin core of the body, and this represents a relatively outer shell. So in the model of 4 levels of pathogen penetration, we have a pathogen working its way first through the sort of relatively outer yang shell and penetrating into this more yin core. That's the 4 levels of pathogen penetration. They have labels. When we're right at the surface of our sphere, this is called a Wei level invasion. You've heard of Wei Qi, that's where it is, right on the outside of your body. It's defending the castle gates, it's got bars across the doors. Once that Wei Qi level is penetrated, you can do anything you like to Wei Qi. It's not going to help you one iota with these systemic immune cases. It's beyond Wei Qi, and no amount of Wei Qi boosting is going to remedy the situation. As this pathogen works its way in, we get the fever of unknown origin animal. It's hot, it's got a pounding heart rate, got a high fever, they're thirsty, probably a little bit on the hot and bothered side, and otherwise not a lot in the way of symptoms. They're just systemically febrile. And then if we move in further, now we're in trouble, because now we're penetrating to the very heart of the situation. Basically, we've moved from the skin to the blood, passing through these various layers in the process. So these last 2 layers are essentially the same layer, plasma and blood. We can kind of consider them together. So Wei level problems, pretty easy peasy, aches, pains, chills. You know, you get a touch of the flu this winter, that's a Wei level invasion. Achy neck, and you take a hot shower because you feel all cold. That's a Wei level invasion. You got a high fever, you're thrashing, you're sweating, you're hospitalized for IV fluids, then that's a Qi level invasion. You have suddenly septicemia, hemorrhage, increased erythrocyte sedimentation rates, you have hemolytic anemia, you are dealing with this plasma blood level penetration, for which the cure is Qing Ying Tong. So Qing Ying Tong was developed to treat this deepest layer of pathogen penetration. So what are these pathogens of Chinese medicine? They're exactly what you think pathogens are, and we could add allergens to the list. So bacteria, viruses, protozoans, microfilaria, anything that you would call a pathogen, the ancient Chinese called a pathogen, except they would also include, say, pollens or other things that are more benign, but still incited one of these 4 levels of symptoms. Vaccines are pathogens. So in homeopathy and other branches of holistic medicine, we look at vaccines as a cause of disease. From the Chinese medical perspective, they are a catalyst of disease. They are a trigger, they are a pathogen. In other words, that would be how Chinese medicine would explain the fact that we somehow miraculously get away with what we do in terms of over-vaccinating and not having everything drop dead, but some things do drop dead, or they get cancer, or they get something nasty. It's those animals happen to be prone to the stuck gate, or that happen to be prone to a pathogen entering the bloodstream. So when you think about yourself as vaccinating, you're taking a needle, you're punching through the Wei layer, you're going all the way down to where that gray sphere was, and that's where you're squirting out your modified live virus. You're literally taking a pathogen and physically bringing it to the blood plasma level. And small wonder that in small animal medicine we see signs of blood and plasma pathogens or pathologies as a result, like hemolytic anemias or systemic lupus. So they're not unpredictable. That's the beauty of Chinese medicine here, really, is that you can see it coming. If this dog has lots of active gallbladder points and you're treating it for hip dysplasia, don't vaccinate it. If you've got to convince somebody it's immune, titer test it, it's probably immune, and then we can all relax. But if the titer test comes back negative and it's 10 years old, it's like, okay, well, clearly it's somehow immune, so just relax. These animals with these rusty gates and these animals with these blood heat tendencies are the ones that will keel over and die from a vaccine. So you can see the problems coming. So you can tell which animals you're really walking a fine line with your vaccinations. So we titer test and we look at the risk of exposure and decide whether that's likely that that animal is going to be exposed to that germ in the first place. And then the owner makes an educated, gives an educated opinion about whether they want to have that vaccine done. And if they have any smacking of a sticky gate or any smacking of prior blood heat issues, I strongly urge them not to vaccinate their animal. And they know the risks when they're going into it. Okay. As with epidemiology, Chinese medicine understood the epidemiological triangle. They understood the role of a pathogen. They understood that you had to be exposed to that pathogen. The beauty of Chinese medicine is we can finally do something for the host, or other holistic medicines. We don't always have to be reactive. If an animal has blood heat and blood stasis tendencies, well, go ahead and treat that using whatever to move them out of that state. And then if they ever do encounter a vaccine, maybe they won't keel over from it. So holistic medicine gives us an opportunity to reduce host vulnerability to these pathogens, including our vaccinations. So the types of pathologies that you need to be aware of as making an animal vulnerable to a vaccine reaction that's exceptionally nasty would be if they have damp heat, if they have blood stasis tendencies, and if they have so-called Xiaoyang issues or sticky gates. Those three things are by far and away the number one diagnoses associated with an adverse vaccine reaction. Okay, so treating an animal from an autoimmune perspective in Chinese medicine means trying to figure out, where is this a problem? Is this a problem of a sticky gate that we should really be using a bupleurum formula for? Does this seem more like a progression of a pathogen to a blood heat level that we should primarily be treating it that way for? And why? We noticed that we weren't really differentiating. We used bupleurum in it all. We gave them both. Because when you've got a pathogen stuck in the gray sphere, it needs to be let out. You need to open the gate. And so the two of them work perfectly and synergistically. From a Chinese point of view, you have this fluid mobilizing, blood cooling, rehydrating influence, and you're opening the gate using a bupleurum related formula. From a biomedical perspective, you have a bupleurum formula to just say, let's all just calm down. And at the same time, you have this vascular impact of at least your Qingying Tong, if not your Chai Hu, blah, blah, blah. So however you slice it, it comes up peanuts, to quote Snickers. Okay, so you determine the layer causing containing the pathogen and allow it out. And you try to clear all these affected layers. You need a formula that treats every single layer. So, for example, Chai Hu blah 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 has herbs that treat the Yang Ming layer and the Xiaoyang layer and the Tai Yang layer, and they basically clear the entire Yang layer. Qingying Tong, when we analyze it, turns out to do the same thing. It has herbs that treat the blood layer and the Qi layer and the Wei layer. So you're treating all three layers simultaneously. If you don't treat all three layers simultaneously, the patient doesn't respond. Once you fix them, then you follow up with interventions to kind of fortify them against the next problem. If they were prone to blood stasis, once they're through their crisis, you work on their blood stasis with whatever your tools you deem appropriate. Let's look at another immune-mediated case. This is pemphigus foliaceus in a Phi-Luke-positive cat. So if you ever wondered if an immune-suppressed animal could have an autoimmune disease, there's your answer. The answer is yes. So Palmer, this is he's a handsome dude, 9-year-old male-neutered Siamese tabby. This is a post picture. I don't have a pre-picture of him. This is one of Dr. Marshall's cases. He's got pemphigus. He's looking good there. He did not look good before. He had a past history of chronic vomiting and what seemed like a little bit of chin acne. Nothing really to worry about. He's had a few episodes of FUS, worse in the winter months. We could have a whole lecture on that. She used saw palmetto. Those of you who are in the This Usually Works lecture that I did a few mornings ago, I mentioned saw palmetto as like an easy peasy thing you can do to stop cats from blocking. So the owner used saw palmetto to kind of stop this cat from obstructing, which was otherwise a regular event. And Jen had him on a 3 seeds combination, which is an anti-damp heat, bladder anti-inflammatory, and things were ticking along nicely. Then in May 2015, he got lesions on his temple and his pinnae. They were round, scabbed, blistered ulcers, also on the foot pads. And he started to lose his hair on his little heels, his calcaneae on the rear limbs there. So Jen went ahead and started him on a raw diet, convenia, in case there was an infection there, and chinging tong, on the assumption that, you know, if it's autoimmune in skin, she kind of thought, well, maybe I should use that, sort of like the whole lupus dog. Flash forward to July. Ears had improved and then relapsed. The feet are worse. Now there are raised oval plaques on the external pinnae, and now the junctions of the pads with the normal skin are starting to get these big raised plaques as well. She gave another shot of convenia. Didn't really do much different with the herbs. August 2015, he did a little bit better, then relapsed again, and she's beginning to get the idea that what's getting the cat better is the convenia injections, just dealing with a bit of a secondary infection, but not enough to really impact. She's otherwise not impacting the immune-mediated process. So scabs, meanwhile, are starting to appear on the eyelids, and the eyes are getting swollen and red. The pads and ears look as bad as ever. Now his hocks are hairless. She did a fungal culture just to kind of cover some bases. It was negative. And then she said, what month is this? Or where am I at as this thing is getting worse? This is late summer. And she remembered the gate. And so she said, well, the convenience is probably just getting rid of a secondary infection. I can't tell if it's working, so I'm going to stop it. And I'm just going to give this minor bupleurum stuff instead and work on the gate, which really means working much higher up in the cat, not on a circulatory level, but on an immune regulating level. Day 15 of treatment, cat's improved despite no convenia. There's a relapse of facial lesions. So they improved and they got a little worse again. She decided, okay, well, let's get the convenia on board. Looks like it's helping somewhat. And she introduced another formula called Hoxy-like combination, which I'll talk about in a second. Day 52, medial canthus was red, but this time just from excoriation. She just used a topical eye ointment. Otherwise, things were looking good. The eyes had become normal. The skin was much improved. And now we're at 1 year. The owner felt she was reliant on herbs for her cat to remain normal. If she took the cat off the herbs, there would be a mild relapse. 2 years, improvements were sustained. So here's his calcaneae, no longer bald. You can see his face looks completely, utterly normal. No sign of any of the pemphigus foliaceous nastiness that was there to begin with. So what about this Hoxy stuff? There was a time in Western herbal medicine, and I'm sure there will people will disagree with me. They probably feel like we're still great at herbal medicine, but there was a time when in American herbal medicine, we practiced much more like Chinese medicine did. Probably one of the last great American herbalists was John Christopher, in terms of having a deep understanding of herbs, which really, you know somebody has a deep understanding of herbs when you look at what they're doing and you go, I don't understand that. Can you explain it to me? It's like, you must be really deep, man. So John Christopher was that guy. And some of today's herbalists did study under him. And so there is a little bit of his traditions alive. At the time, like the late 1800s, early 1900s, herbal medicine was kind of like iPhones, in terms of everybody had a Western herbal protocol to deal with some problem. And they had their systems and their approaches, and you could take these courses in it, and you could buy their systems. You know, you take product 1, you take product 2 in sequence, and it was all over the place. There was Thomsonianism as one branch of it. It was like capitalism comes to herbal medicine. This is all predating the Flexner Report and the beginning of the end, so far as holistic medicine in North America, at least the long hiatus that we experienced anyway. There was a guy named Harry Hoxsey, who was a bit of a huckster, so we call him Harry Hoxsey the huckster, and he developed a formula that was very reminiscent of this earlier, deeper knowledge of Western herbal medicine, which I feel has started to disappear as we become much more biomedical. But back in the old days, they had these more, they had a different understanding of herbs, and he developed a formula that is essentially an alternative or a blood cleanser. Seems appropriate for kind of what we're talking about. It has Chinese medical impacts. We can interpret the formula and kind of get a sense that it's a bit of a qi mover, a bit of a blood mover, a bit of an anti-phlegm, a bit of a heat clearer. But it's a blood cleanser from a early 20th century, late 19th century perspective. He was big on using this formula for cancer. I think it works great in a lot of autoimmune conditions. Anyone seen generalized ossifying myositis? It's a horrendous condition, isn't it? Just nasty. Cats, their muscles start to turn to bone. They get these ossifying centers in their musculature, and literally there's this metaplastic process by which the muscle cells start to turn to bone, and you see all the major muscles in the body start to literally ossify. And there is no known treatment, says the guy behind the boulder. However, Hoxie will cure these animals, and it'll do it relatively quickly. You can get it in time. You can stop the ossification process, which is otherwise a very ugly, painful experience. So generalized ossifying myositis, kind of an oddball condition, but try to keep that in the back of your mind because you just never know what the case dispenser in the sky is going to send you. And otherwise, pemphigus foliaceus is sort of our other sort of knee-jerk condition that we prescribe this for. Hoxie, by being a bitter, cold, cleansing formula, is probably more accurately considered a qi layer formula. It basically addresses kind of more the fever of unknown origin level of inflammation as opposed to sepsis. But it's close enough to the blood that it kind of has a bit of spillover, as it were. There's all the ingredients. And it's, from a Chinese medical perspective, it kind of drain and dry damp, clears heat, moves blood, transforms phlegm, etc. It's an easy formula to find. There's various manufacturers that all make some version of it. The original form had potassium iodide in it as well, which I have taken out because that was in there more to deal with lumps. And while we do use this as an anti-cancer formula, oftentimes it's safer without the potassium iodide in it. There's a few plants in there that Chinese medicine uses as well, such as prickly ash bark, for the same purposes. Prickly ash bark is a spleen-warming, sort of digestion-protecting herb, as well as being an alternative. And meanwhile, everything else, a lot of the things that are in there are very cold. So here's where you can kind of see there is that almost Chinese herbal sophistication behind the design, where they understood to kind of support the digestive process, which needed heat, even as you're cooling everything around it. And oh, by the way, let's use a digestion supporting herb that also deals with lymphatics and has an alterative impact itself. So there's a lot of sophistication behind the design of this formula that you generally don't see, especially in modern day Western herbal medicine. Another case, of course, it's Karen's. 3-year-old Kerry Blue Terrier with chief complaint of pemphigus. Onset 1 month earlier, 8 days following vaccination. The dog is very restless at night. It's itchy. It's got scab and pustule formations on its ear margins, paws, scrotum, vertex, and inguinal regions. Anyone know what the vertex and inguinal regions are associated with in Chinese medicine, or the scrotum? The liver, exactly. You see the lesion distribution, you go, you got liver problems, at the very least from a Chinese perspective. And he actually had them from a biomedical perspective at all, a lot of elevated liver enzymes. Mind you, he's on a panoply of drugs, Venectyl P, which is a kind of a corticosteroid antihistamine combo, Clavamox. He's on prednisone as well, because you can never have too many steroids. It's on Imuran, just in case the steroids don't work. And then we have Zantac. We have Panalog being used topically. We have topical vitamin E. And then we have oral vitamin E at 800 international units daily. And all of that resulted in exactly nothing. So the lesions were persistent, maybe a little bit less itch. The owner goes to Karen and says, look, you got to help my dog out, or you got 2 weeks. She literally said, you've got 2 weeks, and otherwise it's the big needle. And I'm not talking the vaccines. Although apparently the same result would ensue. The dogs had other heat signs, increased thirst and appetite even before the medications, but worse once we roll the medications in. There are no side effects. There's just symptoms being fanned to life. Pulse is very forceful and strong, a very excess kind of pulse to match the excess presentation, the excess skin lesions. It's just a hot, as Karen says, it's a hot mess. So she went ahead and gave the Hoxsey formula 1.5 mils twice a day. She just ditched all the drugs, Imuran, Panadol, Clavamox, Zantac, just get them off the table, except for prednisone, which you have to wean off more slowly. And totally works. Over the next 2 months, resolution of all lesions, mild diarrhea upon administration of the Hoxsey formula, despite that prickly ash bark. So she threw in something that's a bit more spleen protective, digestion protective, even as it's still cooling, which is Simyasan or Four Marvels combination. There's a marked reduction in pruritus, increased playfulness, and continued to sort of wean the dog off prednisone. So I mentioned the dog had liver disease, and when you treat the liver, like if there is a liver component to your pemphigus dogs, if you can fix the liver, you can fix the pemphigus. Acantholysis, of course, is the hallmark of the pemphigus lesion, and that comes from autoantibodies against desmosomes, and that in turn produces a lysis of desmosomes by the proteases. It turns out that both autoantibody production is produced, and the proteases are created by chronic active hepatitis. So when you have chronic liver inflammation, one of the things they noted was that lymphocytes generally get sensitized, and they start elaborating all manner of autoantibodies. Whether you have ulcerative colitis, whether you're hypothyroid, whatever, as soon as you elaborate those, all those will come from lymphocyte sensitization, and that seems to come from chronic active hepatitis. The other thing that happens with chronic active hepatitis is it can't process tissue plasminogen activator. It just says, look, I don't have the bandwidth for you right now. Go somewhere else. The somewhere else it goes to is the skin. And once the tissue plasminogen activator lands in the skin, it goes, what are you, a desmosome? And it totally lyses it if it happens to be covered in autoantibodies. So if you have a pemphigus animal, whatever approach you like to use, fix the liver and you will fix the pemphigus. Okay, so in conclusion, if we haven't already gone over, there's a lot more treatments that you could be using for autoimmune diseases. I've just highlighted a few to kind of give you a sense of how things slot together and to kind of show you what some of the big guns are, at least as far as I'm concerned. And these treatments regularly succeed where conventional medications failed because they act at different levels and in a much more modulating sort of way. Bupleurum, we could sum it up and go, it's modulation without suppression. It's really it's the paragon of democracy, essentially. Oh, I'm sorry. I'm Canadian, I didn't know. Is he not? Oh. Okay, all right, well that's erase. All right, let's come up with another metaphor. So somebody, I think Erin might have mentioned this, Karen says in her cancer talk this morning, how we oftentimes use bupleurum and it kind of comes in there and just enables whoever else is there to kind of rise up and do battle. And it's kind of just creates the foundation for solving a problem. So if we're to think of some other hero, it's the Lone Ranger. The Lone Ranger of herbal medicine. That's what we're going to call bupleurum. Okay, time to wrap it up. Are there any questions? Yes. So in terms of getting Hoxsey into cats, one of the things we found that it works, and I realize homeopathy is out of people's comfort zone, and I can't really explain why it works, but it seems like it does work. So we make a homeopathic version of Hoxsey, and for a lot of cats, we'll dispense it. So we specifically contract Boiron to make that for us. And I know down here in the US, you can buy it from A Time to Heal. The cats are quite happy to receive it in homeopathic form. We were messing around with 12 Cs and 30 Cs. We find 30 C is fine, tends to work. Just use it like you would use the herb, once or twice a day. And obviously, it's little sweet pellets. It's very palatable, and it does seem like it works. And can't really tell you why. Other questions? Yes.
Yeah, the cat also was vomiting. I know opinion was given, but how did she give the Chinese herbs?
So the question was, if the cat was vomiting, how'd you give the Chinese herbs? I think it was a kind of a chronic intermittent vomiting cat, so it wasn't so much something that was happening every day. One of the nice things about minor bupleurum is it stops vomiting. So it's got a lot of herbs in there to kind of settle the stomach, get rid of phlegm. Remember, we said it's kind of, it deals with this triple burner, which it creates a vagal, works in a vagal level to kind of normalize parasympathetic function.
And did she put it as a liquid or because cats are so difficult?
Right. The question was, did she use a liquid or a granular minor bupleurum? I want to say that she used the granules, but you could use a liquid version. Yeah. Other questions? Yes. I mean, for Lancelot? The question was, when we're treating for hemolytic anemia and we're trying to prevent relapse, would you use both formulas together? I almost have to ask Karan now, is he on both formulas preventively or just the Chai-Hu blah, blah, blah? I think he might just be on the bupleurum one. But, you could always start with both. And when you're trying to prevent things, you don't need massive doses. You could start off at maybe even half of a normal dose. You get in there early enough. You get in there before the sticky gate season, before you actually need the gate to function, and you can obviate you can eliminate the crisis. The question was, when we're treating Lancelot preventively, before we get to the season of the year when the gate's important, were you using both formulas or just one? And I want to say we're just using one, but I might be wrong, and I can't see any reason why you wouldn't use the two. Question. So the question was, do we have concerns about using these herbs with meropitant? And normally we don't. But we do find, as you've seen over and over again here, that the animals quickly become not reliant on drugs, and we can eliminate a lot of these things relatively quickly. Any other? Yes? The gates in the time of year. So the yang energy, the question was like, when is this gate functioning? And so you start off in your morning and your yang energy is all internalized. By the time it's noon, your yang energies come out onto your surface. It has to go through the gate. Even though the circadian rhythm chart doesn't show that, it has to go through the gate. Why doesn't it show it in a circadian rhythm chart? Because the yang energy tends to move out of the body relatively easily for the most part. When we really know the gate is not working is in a late afternoon when we're supposed to be pumping yang energy inwards. If it's not, everybody knows it. And so in the circadian rhythm chart, that Xiao-Yang layer is showed as happening in the evening into the early morning hours. And if it's broken, then that's when the problems are going to occur. So in terms of season, we would expect Lancelot to have issues about when he does, October, November, maybe as early as July. And otherwise, we'd expect him to have problems when that gate is popping open to let his yang out the following spring, which is about February through April. Maybe maybe one more question, and whoever else got them again.
When you have an acute case, either the first one or a relapse, you could give compatible fresh packed cells, not in a therapeutic dose, just enough to provide against hypoxia. Then you start your treatment. Patient stable, nobody panics, and then your treatment kicks in and it solves the problem.
Yeah, so that way, if I'm wrong, nobody dies. It's a good idea. Using compatible packed cells is what Jean was mentioning, rather than a full-on transfusion. One more question.
And especially in the southern part of the United States, we tend to
right? So the question was, when the season is kind of all over your place in the fall, does this thinking still consistently apply? The season at which this is considered to be most appropriate is extremely hot summer, or the hottest dry part of the year. That's when Xiaoyang kind of is supposed to start doing its work, but it's supposed to function all the way to the coldest time of the year. So if it's oscillating between hot and cold, I find that the Xiaoyang appropriate, or formula is still appropriate, because it's still, both those kind of climates are consistent with the gate, the sort of the gate season. Okay, we'll wrap it up. Anyone else got more questions? Come on in. Thank you for listening. And how long a break do we have? We have until 4 o'clock for those of you